Absolutely. Yes, ma'am. Let's do a question from my free test bank. Contraindications for administering an enema include all of the following except. Let's be super clear on what this question is asking. Contraindications for enema include all of the following except. Reword it as if you're talking to a friend. Which bitch can get an enema? That's how I'm going to reword this question, okay? So they're saying contraindications for giving an enema except. So it's, which bitch can get an enema? Which of these bitches can get an enema? We have recent colon surgery. Probably shouldn't be putting stuff up their butthole, right? Suspected appendicitis. Ooh, those crampy cramps. That can be confusing with appendicitis. You can also have some vagal responses. Hyperkalemia treatment, acute MI. Do I want them like bearing down and having enema issues and vagal responses, myocardial infarctions? Hyperkalemia. Hyperkalemia is high potassium, right? How do we get rid of potassium? A lot of it super fast. Yep, we give them diarrhea. Either an enema or K-Exalate, they drink it and they have diarrhea. Drum roll, please. Correct. The answer is C. All of my questions in my test bank will have a rationale explaining why that was the correct answer and why the other ones are not the correct answers. I hope that sort of cascade of finding what the question is asking, eliminating wrong answers right away, and then honing in on the correct answer, plugging it back into the question. I hope that helps you.